Hello everyone. This is my research presentation about reducing the amount of anterior cruciate ligament tears in the sport of soccer. Firstly, I will provide you with some background information about anterior cruciate ligament tears and what research has been previously conducted. I will then explain the objectives of the study before continuing on to the study design, subject information, and measurements. Then I will be providing some information about potential statistical and ethical issues before concluding with some possible limitations of the research. The participation in sports at any level allows for people of all ages and abilities to become more susceptible to obtaining an injury. Soccer specifically requires a significant amount of running, jumping, contact, and sudden changes of direction. These actions require a lot of support and stability from the knees, and far too often result in the tear of the anterior cruciate ligament. This study specifically was created to answer a question that focuses on one of the most susceptible populations of this injury. My research question is, does the participation of 16-year-old rep female soccer players from Durham region in knee strengthening and injury prevention programs reduce the amount of anterior cruciate ligament tears suffered amongst this population during a summer season? The anterior cruciate ligament, or commonly known as the ACL, is one of the key ligaments of the knee. It is located behind the patella and is connected to both the distal end of the femur and the proximal end of the tibia. The ACL plays a significant role in the knee stability. Therefore, when it is torn, the knee becomes unstable and the femur is allowed to glide further forward over the tibia than it should. This ligament usually tears in sports that have high demand for sudden changes of direction, and in many cases require surgery to treat. In fact, nearly 250,000 ACL injuries occur in Canada and the US every year. In previous research on anterior cruciate ligament injuries, intervention programs that were used stressed the importance of addressing how athletes can control and modify their movements. This was done in an attempt to reduce the amount of modifiable risk factors that the athlete would encounter. Although many programs failed to acknowledge the importance of muscle strengthening and the balance of muscle groups when limiting the occurrence of this injury. In addition, many previous programs focused on soccer players who are older and less willing to learn new techniques or modify the way they move while playing. The study I will be conducting will include both teaching athletes how to modify their movement to reduce these risk factors, while also focusing on appropriate muscle strengthening and conditioning to limit the strain on the anterior cruciate ligament. This study will also be focused on a younger population that is likely to be more open to attempting new movements and techniques. Conducting this research will provide further knowledge of how to improve anterior cruciate ligament tear prevention interventions, providing athletes with new movement techniques along with strengthening, while focusing on a younger population will hopefully lead to a change in the way all players move and develop in future years. The general research objective of this study is to determine if the use of the anterior cruciate ligament injury prevention program reduces the amount of soccer players who obtain an ACL tear. The specific research objectives are as follows: to evaluate the amount of young female soccer players who obtained a knee injury, to compare the amount of ACL tears that occurred within the intervention group against the amount which occurred in the control group, and to determine whether or not the ACL injury prevention intervention should be implemented as a mandatory program for all competitive female Durham region soccer players. This study will be conducted in Durham Region with 16-year-old female rep soccer players from the same league. The design that will be used to conduct this research is a prospective cohort study. This study will allow for the following of the groups of individuals over time, who are either exposed or unexposed to the intervention method, and the comparing of their results. The study will consist of 3 groups: the control group, with individuals who will not be a part of the intervention; the intervention group, consisting of participants who will be involved in the interventional ACL injury prevention program; and the previous injury group, whose members have had prior knee injuries and will also be using the intervention program. These groups will be followed throughout the course of the summer season, and all of their knee injuries will be assessed and recorded by the licensed physical therapist. When the experimental period is complete, the amount of knee injuries and ACL tears will be compared between the 3 groups. The selection criteria for the study includes both inclusion and exclusion criteria. The inclusion criteria are that all of the soccer players involved must be 16 years of age and female. They all have to be from the same rep soccer league from the Durham Region Soccer Association and must be a part of the team roster for the summer season. Individuals must also inform the researcher of any previous knee injuries that had them out of soccer for more than 2 weeks, so they can be correctly allocated to the appropriate group. While for exclusion criteria, those of whom that are currently injured when the study begins will not be included. In addition, individuals who choose not to participate in the group they are allocated to will be removed from the study. This will be done to prevent participant preference bias, as certain types of individuals may be more inclined to be a part of one group over another. As for the recruitment of participants, individuals will be randomly selected from teams within the Durham Region Soccer Rep League for 16-year-old females and allocated to different groups. They will either be part of the intervention group that participates in the knee strengthening and ACL injury prevention program, a control group with no intervention, or an intervention group with those of whom who have had a previous knee injury. This will all be done with the consent of a parent or guardian, the athlete, the league, the soccer club that the child is associated with, and the ethics ward. The main outcome variable of this study is the reduction in the amount of anterior cruciate ligament tears amongst those of whom who have participated in the leg strengthening and ACL tear prevention program. The individuals who are part of one of the intervention groups will participate in the programs twice a week. This will be measured in hours, as they must participate in the program twice a week for half an hour each time. When the summer season ends, the amount of injuries that were sustained by the participants will be analyzed. The amount of ACL tears will be confirmed and recorded throughout the season by a physical therapist using the Lockman's test. Since the study is focusing on whether there is an ACL tear or no ACL tear, the variables will be dichotomous. The hypothesis for the study is that the intervention group will have fewer participants that experience anterior cruciate ligament tears during their summer season. In addition, those of whom who have had previous knee injuries will suffer less ACL tears than what is expected of them from other studies. Considering that the dependent variable in the study is dichotomous and only has 2 potential outcomes, logistic regression will be used. In addition, descriptive statistics will be used to give a better understanding of the relationship between those participating in the intervention program versus those not doing anything about limiting their chances of developing this injury. while inferential statistics will provide knowledge on the potential effectiveness of this intervention for reducing future soccer-related ACL injuries in the Durham region. One ethical issue that will arise during this study is that not all individuals will be offered the opportunity to participate in the intervention group because choosing a group would influence the validity of the study. Therefore, to manage this issue while maintaining the quality of the study, those who choose not to participate in the group that they are allocated to will be excluded from the study completely. Although these individuals may still use the intervention for the potential benefits if they choose to do so. Secondly, there is the ethical issue of being legally able to conduct the study on children. These legal issues will be avoided by receiving consent from all of the parties involved. This would include, but is not limited to, the athlete, the parent or guardian, the team coach, the soccer club that the child is involved with, and the Durham Region Soccer Association, and of course the Ethics Board. One of the potential issues of this study, which may lead to some difficulties with its completion, is recruiting enough athletes to participate to achieve quality results. Another issue could be the lack of participation in the program from the groups taking part in the intervention. Since the study is on young participants, it may be beneficial to provide them with a reward for their efforts and participation. An example of an incentive could be getting your name in a draw to win a soccer jersey or soccer shoes if you effectively participate throughout the study. Well, that concludes my research presentation. Thank you for listening.